A number of years ago, the only substantive threat a doctor faced was getting sued in a traditional court. Fast forward to today, the number of threats have multiplied. Now doctors still need to be concerned about being sued in court, but they also need to be worried about being sued in a small claims court. They need to be worried about complaints filed against them with the medical board. They need to be worried about HIPAA and complaints filed with the Department of Health and Human Services. They need to be concerned about the Federal Trade Commission. They need to be concerned about the Federal Communication Commission. And then there are threats where patients send a note or send a letter to the doctor saying that if they don't get a refund or free surgery, they're going to slam the doctor on the internet, or they're going to file a particular complaint with this particular organization. Our role is to address this expanding territory of new threats that didn't exist actually when I practiced a number of years ago.
If you can imagine making a mold of my head that's a quarter inch too small all the way around every direction, and then putting it on and just having it squeeze every...
But Lewis's doctor was later arrested on charges of overprescribing.
William Hurwitz, a pain specialist who was sentenced to 25 years in prison for drug trafficking.
Every doctor in Virginia just up and left.
There's pressure on prescribers, especially in Montana, and so I think that the writing is on the wall. They're becoming more fearful.
What most people don't know is that the chronic pain sufferers out there are not getting treated. This is so out of control, and it's on an unbelievable scale. It's bizarre what is happening across our country right now.
Many doctors have been arrested for running so-called pill mills and turning patients into addicts.
The DEA and the Hamilton Boone Drug Task Force arrested 11 people in that raid.
Dr. Richard Rand, arrested in San Francisco 3 weeks ago.
Dr. Atiga, under arrest.
The doctor was arrested along with 12...
Tennant, who's one of the last doctors in America, willing to take patients who say they need a high dose of pain medication to function.
The rare cases in the other states are really being just cast out totally.
During his time in politics, Tennant was instrumental in pushing forward the Pain Patients Bill of Rights in California, which explicitly spells out that opiates can be a safe and effective form of pain treatment. Tennant acknowledges that opioids were overprescribed in the past and should generally be a last resort for pain treatment. But he believes the media and government have now gone too far in demonizing them, and it's legitimate pain patients who are paying the price.
Once you start opioid drugs, this idea that you can just quit them and that your pain will magically go away is a myth. There are people who can take opioid drugs at a very high dose for many years.
Yet an underreported fact is that pain patients aren't the problem when it comes to opioid abuse and addiction in America. A study from the Cochrane Review found that when legitimate pain patients are screened for prior addiction issues, fewer than 1% ever become addicted to opioids.
They're trying to give the idea that we can't tell the difference between the addict and the legitimate pain patient. Simply not true. It's easy to do.
Tennant believes the country needs more pain specialists like him who are willing to take the difficult cases and challenge the emerging conventional wisdom that opioids can't treat pain. The effort to completely discredit opioids as a legitimate treatment option, he says, will only lead to more pain, resentment, and tragedy.
You just can't throw legitimate, good, solid citizens who have pain, start calling them addicts and start calling them substance abuse disorders, and you're starting to develop great resentment in these people against their government, against the media.
We're tired of the battle, tired of fighting with the insurance companies, tired of fighting with the doctors to describe what we go through every day.
The suffering is inhumane. And this is just a medication to treat pain. It is not the first line of medication.
Billy Earley is a physician assistant and he is a healthcare advocate for the National Advisory Board for Black Doctors Matters. For the National Advisory Board of the American Pain Institute. For the World Sickle Cell Federation and Humane Treatment of Chronic Sickle Cell Patients, and you can hear and read Billy's latest editorials and writings at www.doctorsofcourage.org. Please support our cause by donating to the American Pain Institute, to help sponsor our march and congressional briefing in Washington, D.C. on April 25, 2018. You can help us make a change by signing our petition at change.org to enact a medical board civilian police review committee to help stop doctors and nurses from being falsely prosecuted and unlawfully attacked by special interests groups like CVS Pharmacy and their partners at the drug enforcement agencies. You can find the links how to donate and sign the petition in the description box below. Thank you.